We have a fireside chat. Please welcome Suneet Varma, former Global President of Oncology at Pfizer, Ryan Steinberger, SVP at Pfizer Digital, and leading industry consultant Jennifer Tyler. Their fireside chat will be on making technology work for life sciences outcomes. Please welcome them.
Everyone. My name is Jennifer Tyler, and 12 years ago, I started a strategic management firm and currently am an advisor to Indegene. But prior to that, I enjoyed a 20-year career at Pfizer, so I'm delighted that Indegene provided this opportunity for me to have a little family reunion with a few friends of mine. But before we get started, I'm going to ask my colleagues to introduce themselves to you so we can give context to our opinions and past experiences, how they can bring strength and insights into the field of technology and where the business is going in tomorrow.
Okay, well, good afternoon. My name is Suneet Varma. I retired as the Pfizer Oncology President earlier this year. Since then, I'm exclusively working in the biotech space with companies that emanate out of universities and hospitals. I'm currently the chairman of the board of CoRegen, which is an oncology peri-phase 1 clinical stage company based out of the Baylor College of Medicine, and Rion, which is a regenerative medicine company, which is a mid to late stage clinical stage company out of the Mayo Clinic in Rochester, Minnesota. So I'm living the dream, and I'm happy to be here, and I'll turn it over to Ryan to introduce himself.
Yeah, so good afternoon, everybody. My name is Ryan Steinberger. I'm currently the head of digital for research and development at Pfizer. Prior to that, I led digital for our commercial business, where I worked with Suneet. I also have led our generative AI transformation program at Pfizer as well, and just recently was added to the Indegene GenAI Advisory Council, which I'm excited to be joining them. So thanks for having me.
Well, throughout today, we've heard discussions about data and technology, and all three of us commented before how much we enjoyed the insights from Hannah and Jeff. But I think now the opportunity is to discuss how, as leaders, do we make some of the trade-off decisions on where to put our investments and to optimize the return, both in engagement from HCPs, but payers, and across the healthcare ecosystem. So let me start the discussion this afternoon with a question to Ryan. Can you share with us your thoughts of how organizations can ensure technology is really serving as that underpin from investments, but doing so in a way that drives successful outcomes for the business?
Yeah, it's a good question. And I'm going to start by saying I'm a pretty simple guy. So in my mind, I try to keep things very pragmatic. And I think a lot of the behaviors that, frankly, are just being good stewards of investments apply in this world even more so. So one, being really clear about what the business outcome and the business strategies are that you're trying to enable, and keeping them incredibly focused. No more than 3 to 4 strategic pillars, being very clear on what the vision is for those pillars, what the outcomes are that you want to drive. Because when GenAI burst on the scene, it was all about use cases. You guys probably all did that at Pfizer. We did 22 of them. We delivered them all in 6 months. When it started, I thought we would deliver maybe half. We delivered them all. What I'm noticing is we actually have a problem of a graveyard of successes. So the question is, what do you scale? And that's quickly becoming the key problem. So being grounded in what are we trying to accomplish, what's the ROI on each of the use cases? So when teams come and pitch me investment ideas, the first thing I say is, what's it worth? What you'll find is a lot of people will say, I'm not sure, because it's new. And we send them back to the drawing board. What do you think? And I've used it now I've aligned it to the scientific method where I say, in my current role, you're a scientist, give me your hypothesis. And we make them give us their hypothesis, and then what we do is we rapidly go to an MVP, minimal viable product, and we confirm. It's sort of like doing the hypothesis validation in our development programs. And then from there, we make the determinations of what to scale. So it's a very dynamic and iterative process so that we're always prioritizing the things that make the most sense and are going to bring the most value to the company, but they're always grounded back to what our overarching organizational goals are from a business perspective.
Yeah, Jen, can I add to what Ryan said?
Yes.
and let's say as a senior commercial leader running a division or a business in Pfizer, we sometimes get asked questions like what Ryan is raising, which is, what is your digital strategy? What is your AI strategy? What is your technology? And not being a digital guru or an AI specialist, I go back to what is our business strategy and what is our commercial strategy, and how can digital or AI technology further that strategy? We used to get asked this question by the investment community, by Wall Street all the time. What's your business development strategy? And we would say, business development is not a strategy. It's an enabler to achieving our business strategy or our patient impact goals. And I would say the same thing for technology. It's a slightly different twist on what you might hear from others, but if you know what you're trying to achieve, and in my case, very simply, I know it's a cliche, we're there to cure cancer. Okay? Or at least make it a chronic condition, whatever definition you use to cure cancer. And so anything that's in the AI, digital, or technology space, which enables that to be achieved further, faster, beyond, over, above, whatever adjective you want to use, well, then that's the strategy that we would want to employ. And then you would take Ryan's business cases and use cases, and you would do all the metrics, et cetera. But I think that's let's say in the world of pharmaceuticals, we have something called public-private partnerships, right? Where you work with, I think that inside a company like Pfizer, or even in the biotech space that I currently operate, you want, essentially an enterprise digital partnership. And that is really what makes, let's say, the successful outcome.
We heard earlier this afternoon about the decline in engagement from HCPs, and oftentimes that can happen because of the complexity. So Jeff and Hannah spoke a little bit about how do you actually define that right channel. So when we think about your opportunities as a commercial leader, knowing that GenAI and digital agents have an opportunity to be both helpful, but also bring forth a level of complexity. How do you as a leader, Sunit, really look at GenAI and agent delivery to accelerate your decision-making without it become complex?
Yeah, it's a very interesting thing, because I have heard a lot today, and it's been a very exciting day, about those kinds of outcomes. Like, how can I really think about the customer and make them central to what I do? I will just say, as a general manager, I believe and agree with everything that's been said here, which is, I feel like the promise is there, and I'm not questioning that. The problems that I have had in achieving that is the implementation, which is, how do I get to that outcome? The number of projects that I've launched, Ryan, you used the word graveyard of successes. I think what you're getting at is that there's so many barriers to making that vision a reality that it just literally exhausts me. It exhausts our teams. And, there's so many barriers in a large organization to overcome to, let's say, realize that. So if you say to me, well, this customer wants this kind of engagement and they're not satisfied by the current communications, I agree. You show me a final solution, fantastic, I love it. The problem is, how do I get from here to there? Mm-hmm. And I find there's so much friction in an organization. And I'll give you some examples. So when I'm in a meeting and somebody says, well, that's not compliance, I immediately have my antenna up and say, that's total BS. Because we're here as leaders to say, don't tell me what I can't do based on the traditional model. Tell me how we can achieve what we're trying to achieve. And so you find yourself spending a lot of energy navigating the internal organization rather than having the external impact that you want to have. So I think that when I saw that market research and the DT people who presented were, I thought, very good and very excellent, and I could clearly see where we wanted to go. But I did struggle with, gosh, but how do I get there through all these barriers and hurdles that are erected in large organizations? By the way, in biotech, it doesn't happen that way, because I just say it and we all do it and there's like 3 people. So it's really easy. But I think the real unlock, because the majority of the value is coming out of big pharma in terms of customer engagements, connections, products, patients treated, et cetera. So that's kind of how I see it, Jen. But yeah. I don't know if, Ryan, you want to add to that. Well,
Sunit would have led you to believe that we didn't listen to him when he was at Pfizer, and we did a great deal. This is the point around focus. When you're in a big organization, there's lots of excitement, there's lots of energy around all of these capabilities. Like I said, they all work. like what I've seen. They generate the value. So I think if you're not focused, some of the other barriers come in and really get in the way of really the progress that you can make. I think in terms of the question Jennifer asked, though, too, around decision making, for us, or for me, what I'm seeing, it's a huge accelerant. I mean, a massive accelerant. Hopefully all of you have used AI today. I mean, I use it, I've already used it like 15 times today. I use it at work constantly. And what does it help me do, right? It helps me very quickly aggregate information, helps me formulate my thoughts. It helps me start to focus what I need to look at in order to make a decision. I find that I get to decisions faster. At an enterprise level, what we're applying it to is in a lot of spaces like our knowledge management. It's a great synthesizer of all the enterprise information we have. We're making very complex portfolio decisions now in ways that we could not do. We're doing scenario planning. We're doing what-if analysis, all using the AI tools that we have at our disposal. What if a competitor's pipeline moves a little bit? What does that do for us? What does that do for our forecast? These are all things that you're now able to do with AI. So I think the key thing, though, that I've been really focused on is making sure that all colleagues use it. And I think that's the key thing. We actually track adoption metrics for all the employees to see who's actually using it. For us, Microsoft Copilot's our proxy for that. Like, who's actually using it? And we can see how that's sort of increasing month by month.
Okay.
Because you have to use it in order to get comfortable, in order to incorporate it into some of your decision-making processes.
You want to add something?
Yeah, I was going to add, because I didn't exactly answer your question the first time around, but what I would say is that Ryan's exactly right. When we first started using AI, it was like, oh, let me write a better email, and I take what I wrote and put it through, and let's let it take minutes of the meeting and stuff like that. Those were like very exciting at the time, but now you look and say those are very rudimentary applications here. I recently hired a guy out of Cornell's Johnson School of Business. Okay, so MBA graduate. His name's Franco. And I said, Franco, we need to size the, oncology market for checkpoint inhibitors, with products that are coming. And he's like, well, let's call, Trinity Partners, which is anybody from Trinity in the room, by the way, just before I criticize them? Okay. And they're like, look, we can do a research report for you. It'll take 8 weeks and, $100,000. And I'm like, oh my God, I'm raising capital. I don't want to spend $100,000. Franco's like, no problem. At Cornell, they have a whole class on structuring sophisticated queries. And in one day, he gave me a report that looked like $100,000. Nice. And I said, wow, I thought in universities they discouraged using AI because there's always this healthy tension around academic integrity. Like, you're using it to, cheat on a paper or write an essay or do something like that. And they're always trying to, this cat and mouse game with students. But he's like, oh, no, when you get to business school, it's a mandatory. And it's a mandatory in our business today. And I'm learning a lot from Franco in kind of reverse mentorship. But what I would say is that has dramatically accelerated the access to analytics, to information, the cost of acquisition of that. It's a totally different model. And I actually, frankly, was a bit naive to it until I got into this space and see how it's working. So that's really an example of literally, I don't want to say, but 1/100th the cost and 1/50th the time.
And if I could add to that, though, what you just raised is that decision-making requires alignment across a lot of people. And I think we all have to just remain open to the fact that not everyone will be at the same level of understanding. And so we first have to make sure that we're all entering the conversation from the same framework and point of view so that we really get to a solution and some decision making. Let me move to our next question. We're asked, as you build strategies, or what strategies within your own teams have you deployed to really help the focus stay on real world results, thus not really preventing technology from becoming the goal instead of just an enabler?
I'll start.
Great.
This is a passion of mine. The inevitable solution looking for a problem. When you're in my role, with all due respect to the consulting community in the room, I'm inundated. Everybody's coming to me with a solution. And then they're asking me to go find the problem. And by the way, I do appreciate that because it opens my mind. I learn a lot. It's great. But, I think as a technology leader, I'm going to take it from this perspective of my role. we have an obligation to expect different things from our teams. And, you know, an example that comes to mind was when we were looking at blockchain. If you frame it as, hey, I want to go do something with blockchain, you're going to get something from your teams. But if you frame it as, you know, I want to increase supply chain transparency and you know, reduce counterfeit, the risk of counterfeit, you'll probably get a solution that may include blockchain, but probably some other things. You're going to get the business outcome that you want. So everything we do for my teams is, every objective is a business outcome. We don't celebrate go lives. We do, but that's not really the end point. They're all measured by, did the project achieve the business objective? We're getting into much smaller, it's been mentioned a few times today, very hyper-focused cross-functional teams. And especially in the age of AI where, you know, for me, it's not about a step change in the process, which I used to do with RPA and every other digital transformation that came before. It's literally about, how do I reinvent the process in an AI world? That's a completely different thing. So what we do is we try to start with the experience we're trying to create and work our way back and lead that into the technologies themselves, into the models that we're going to choose and those sorts of things. And when you do that, what's really important, anybody that's in the business side, is that cross-functional team, make your engineers, they need to sit in those rooms with you. Like, those technical people need to sit there with you while you're thinking through it, because people that are not even that close to the process, you'd be amazed at what they come up with, because they go, oh, wait, I saw a way, for example, an example Jennifer's given, you can prompt, and you can give it the context, and then it just illuminates the next round of thinking. So for us, it's staying grounded in the outcome, grounded in the experience, work our way back, and then let that drive where the technology investments should come.
Could I just build on the question, though? Do you actually find that it's helpful to execute and launch technology broadly at once, or as Pfizer, have you been doing it more step-wise and then adding one team to another after you've had success?
We do it very much in an agile manner. So, you know, like I said, the goal is getting speed to value as quickly as you can. Like I said earlier, like, confirm the hypothesis that you wanted to do is correct, and then make the decision about whether or not you really want to scale. Because, you know, a lot of the kind of classic technologies that we used to do were big capital investments. I mean, like, you know, massive capital investments. That's not this world in a lot of the stuff. I mean, we were spending a lot of time talking about data foundations, incredibly important. Those are still big capital investments. But a lot of the business cases and the transformation that you can do on processes, you can do in a pretty lean and light way now, which is radically different. So it's that kind of test and learn, you know, sort of thing, those continuous feedback loops. We're putting in agentic systems that help us learn from what the AI is doing, because that's the next evolution of this. We're all going to have models out there, but if you're not monitoring the effectiveness of your model, that's going to be problematic, right? So you have to have those continuous feedback loops built in.
Terrific. Suneet, would you like to add something?
Yeah, I was just going to say that just to Ryan's last point about what you call test and learn, you know, I always think of as course correction and adaptation. The reality is that we are learning and we don't really know, which is why hence the word test and learn. So organizations that I've seen, or teams that are successful, are ones that are able to spot issues, course correct, adapt, and change. Because I think in pharma, we're very rigid. We make a plan, we pressure test that plan, we get buy-in on the plan, and then that plan is like literally written in concrete. And I think a plan should be written in Jello. And it should be that you can adapt and course correct as you go along. And that is actually a key success factor to realizing the impact that we want, especially when we're looking for what you described in the real world results. And if I could, the value of the real world results has to be measured, and this is of course my opinion, in both internal value and external value. Because I think what happens is a lot, you can talk about efficiency, what is it delivered to the internal organization, and we all want that. Every company in pharma is under some degree of pressure to be more efficient or effective while being efficient. But externally, what you saw from the CX data is that customers are still fundamentally dissatisfied, or their trend is towards negative satisfaction. So I think that when we're creating use cases, and we're, let's say, course correcting and adapting, we should mind the tangible value between the internal value that we can point to, so that everyone in the organization stays, let's say, attached to the idea, and supporting what we're doing, but you also still have that external value in let's say in your sites, because that's ultimately what we're here for.
Yeah, and so it's that patient and that payer organization, that customer that we're trying to achieve. But can both of you give me a few examples of something practical that you've done to really simplify digital transformation? So we're kind of going back to our initial question. So if we don't make it complex, but at the same time, we're leapfrogging ourselves to bring that value to the patient or to our payer customers.
Yeah, I'll give two examples, and there are Pfizer people in the room here, so they'll recognize some of this. One of them that we did before was we called it Country Lab, okay? And I used to love this. We don't do it anymore, but listen, it's a pendulum in the industry, so sometimes you do things and they're very famous.
10 years later, it will come
popular, and then unpopular, and it will come back again. Right. But I saw earlier today someone had shown an example that we tested this in Taiwan, and then we used that to incubate the idea, and then we rolled it out globally. That notion of a country lab is not just picking one brand in the US or one vertical, but picking a whole country at scale to test something, which will seem small in the global context, but is massive for that geography that you're doing it in. This notion that Pfizer implemented, we used Australia, by the way, as our country lab at the time, where we would test all these things at scale for that country. And this idea came from a gentleman named Shantanu Narayan. And if anybody knows who he is, he's a Pfizer board member, but first he's the CEO of Adobe. And when Adobe switched their model from the Adobe Acrobat software, which I think we all probably use, from you buy it for $49.99, but then it was going to become a subscription service. Does anybody, everybody who does it probably has a subscription. And the way Shantanu described it was that a third of his customers would always buy the new version before the subscription system was invented. A third would kind of do it every 3 or 4 iterations, but not every time a new version came out. And the last third never upgraded. They would just stay on the version for as long as they can until their computer, conked
Probably
out.
Was me. Yeah.
So they said, you know what, we need to change this model. Let's create a new subscription model. And that way, everybody, you're paying, whatever, $19.99 a year or whatever the fee is, and we're going to convert the whole world of Adobe to subscription model. And I think what was amazing about that is that, of course, everybody freaked out because this is going to be the end of the company. Nobody's going to sign up for this. Nobody wants a subscription. Of course, now we know subscriptions are all over the place in media, et cetera. But they tested it in Australia as a country lab. They converted the whole country at once to the model, worked out the kinks, and then they rolled it out globally. So that was like a way to enable a massive technology transformation.
Yes.
Yeah, there are literally hundreds of examples. If you take, clinical trials, probably all of us are trying to use AI for recruitment. I think one of the things that we're looking at, given our portfolio and the breadth, the recruitment challenges, while there is some similarities across them, it's very different in the vaccines versus in oncology. The HR data is where you're going to go is going to be different. So we've taken a much more, we've tried to sort of segment, if you will, the opportunities as appropriate so you can get to that, quickly, get to that proof of value, and then work from there. But, Jennifer, I don't know that we've spoken enough about here. It's been alluded to by some prior presenters. What I'm also seeing is the people elements and the change management, especially in AI, is a big challenge. A lot of the things that we're looking to do, I think we need to be honest, and we need to be honest with people. People are worried about their jobs. I think you need to say that. I'm doing a lot of things with document authoring, for example. A number of you are probably doing some similar things. And the very people that you're going to say, hey, how do you like the output, are some of the people that are worried about it. So one of the things that we've been really focused on is trying to demystify it quite a bit, trying to enlist people in the change. So I think as leaders, being upfront, having a really clear vision, make sure that the vision is something that everybody can kind of understand and internalize, and making it, relevant for them. So example in that case is, talking to, for example, medical writers, and just basically show them the breadth of the portfolio, the fact that, like many, cost is becoming a problem. We simply won't have the money to deliver what the pipeline's coming, so it's allowing us to get, greater leverage out of that team and things like that. So they start to see a path forward and a future with them in it. And I think that's been, for us, really critical to driving, some of the adoption and some of the transformation that we're trying to do.
Anything to add there?
Well, Ryan, just a question for you, because I'm retired. Are they still doing pilot and command at Pfizer? Or is that not used anymore?
Yes.
They are. Okay.
Would you like to explain to the audience what pilot and command is?
Yeah, well, pilot and command, it's essentially a model where you take a person and say, you're the pilot and command for a cross-functional collaborative project, which involves legal, medical, commercial, digital, and you say, you're responsible for implementing this AI, GenAI technology, I'll make it up, to transform MLR in the company. And that person is vested with all the authorities to command, pilot and command, the crew, even if they're dotted line responsibilities, not just solid lines. And so I found that to be a nice enabler, but of course you need sponsorship of that, because many of the dotted line people, they don't like to listen to the dotted line boss. They want to talk to their solid line boss, so they always say, well, I'll agree to you now, but I'm going to go talk to my boss offline. So, but that pilot and command model allowed us to do, I would say 2 out of 3 things that I did with pilot and command worked very well. But 1 out of 3, didn't, because sometimes it violated the organizational principles. But I think the notion of a cross-functional, collaborative, empowered team is what made that very successful.
Excellent. And I think what you just commented reminded me of Marion's discussion earlier, that it's also okay to have a failure, right? It's all about how do we work together to navigate this space and bring value moving forward. I wanted to thank everyone. We have time for one question, if there was any questions. Perfect. All right. Thank you, gentlemen.
Thank you.
Have a great afternoon.